It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question in this series of questions from my client Robert. And the question last week was part 7 of my 68-year-old mother is in intensive care with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. You can also find previous questions answered from Robert in this series of questions by clicking on the links below this video. And if you're watching this on YouTube, go and click below on the link that gets you to the website where you can read all the other episodes of this series of questions. But let's look at this week's episode of Your Questions Answered, and I want to answer the next question from my client Robert, which are excerpts from email counseling and consulting sessions with me. And the question this week is part 8 of my 68-year-old mother is in intensive care with gastric perforation. She's not waking up after the surgery. Will she need a tracheostomy? So, Robert continues with his mother's situation as follows. He writes, "Hi Patrick, it's been a long day for me and the family. First, a few quick answers and updates. They closed the abdomen after the last surgery. The oxygen support she's getting now, I think, is at 60%. They have indeed tried medications to increase urine output but hasn't helped much. We had a small positive bump in urine production this afternoon up to 15 mL per hour, but has since headed down from there. Currently, we are seeing some swelling across her entire body. She looks puffy. We were informed that this is related to the kidneys malfunctioning and not processing the fluids in the body appropriately. Not sure if there's anything that can be done to help with the swelling or if we should be worried about it. The blood pressure medications required to maintain her blood pressure are relatively low. They're considering seeing how she does if they took her completely off them. She's also being provided nutrition intravenously, not via the nasal tube. The surgeon asked that we give the gut some rest since the surgery and not make it work too hard yet. She has had no fever for the last couple of days and the heart rate is stable as well. There is no neurological response today. I'm talking to the doctors. They were very despondent today. They reiterated that she's having issues with multiple organs and the kidneys are the most concerning at this stage. They seem really worried, and the prognosis that we've heard is that she has about 20 to 30% chance of making it through. Now, we accept that she's not doing well and not looking well either. But her lead doctor earlier said that kidney issues are not uncommon a few days after surgery. And the fact that we've seen some minor neurological improvement is encouraging. Your insights on the information I provided would be much appreciated. Kind regards from Robert." So here is my response. "Hi Robert. I am very sorry to hear that things are not moving in the direction that you and your family had hoped. Now, I want to look at your updates first and quickly comment on some of those before I then answer your other questions in the next email. So first, you said they closed the abdomen after the last surgery. Now, Robert, that's a good sign. You definitely want to have a closed abdomen. In some cases, they do a stoma or leave the abdomen open because of high abdominal pressures. Next, you have mentioned that the oxygen support is getting down now to 60%. Again, that's a good sign as you don't want to ventilate on 100% for too long. Number 3, You mentioned they have indeed tried medications to increase urine output, but it hasn't helped much. I'm not overly surprised if the kidneys are slowly but surely failing, unfortunately. Next, you mentioned that you had a small positive bump in urine production this afternoon, up to 15 mils per hour, but has since headed down from there. 15 mils per hour, Rob, is minimal. So therefore, they've got to think about different strategies there. Next, you mentioned that you are seeing some swelling across your mother's entire body. She looks puffy. You were informed that this is related to the kidneys malfunctioning and not processing the fluids in the body appropriately. You're not sure if there's anything that can be done to help with the swelling, or if we should be worried about it. Now, the puffiness you're referring to and that you're seeing in your mother is related to low urine output, as well as being immobile for a relatively long period by now. The longer somebody is in a critical condition and in an induced coma, the higher the risk and likelihood of fluid retention in the skin. Imagine your mother not moving for many weeks now, plus the deteriorating kidney function is a recipe for fluid accumulation and puffiness. There are a few things that can be done about it. Number one would be hemodialysis, and I believe it's almost inevitable by what you are describing, and it could reduce the puffiness relatively quickly within 48 to 72 hours. Number two, your mother's albumin levels might be low. If albumin is less than 25 in the blood tests, she may need some 20% albumin infusions. A low albumin contributes to being puffy because fluids basically leak from the arteries and the veins into the cells and can't be pulled back because of low osmotic pressure. Therefore, hemodialysis to get rid of some excess fluids, but also by giving 20% of albumin if albumin levels are low, are a good combination to reduce the puffiness. Also, a low albumin and not retracting fluids back into the veins and arteries may also contribute to a low blood pressure. Next, you are saying that the blood pressure medications required to maintain her blood pressure are relatively low. They're considering seeing how she does if they took her off completely. Now, Rob, it's always good if no inotropes or vasopressors for low blood pressure are required. However, in light of potential acute kidney failure, achieving a mean blood pressure greater than 65 mm per mercury would be essential to keep the kidneys perfused, from my experience. Next, you are saying that your mother is being provided nutrition via IV or intravenously and not via the nasal tube. The surgeon asked that we give the gut some rest since the surgery and not make it work too hard yet. That's great, Rob. TPN, or total parenteral nutrition, also known as intravenous nutrition, will do for now. I have no concerns there. Giving the gut a rest is a good idea after the abdominal surgery. Next, you mentioned that there has been no fever for the last couple of days and the heart rate is stable as well. That's a good sign, and it may be a sign that the antibiotics are working and that the abdominal surgery is improving things as well. And you also mentioned that there is no neurological response today. Now, as you would have known by now, your mother went back to surgery in the last few days, and that means more sedatives and opiates. Your mother is also still fighting an infection, therefore she's allowed to rest for now, I suppose. I know you and your family have been waiting for your mother to wake up, and it has yet to happen. I know how frustrating this is to wait and nothing is happening. Again, Robert, please be patient. It's often two steps forward and one step back. Also, your mother has been in and out of induced comas in recent days, especially with the abdominal surgery and the tracheostomy. Therefore, your mother has more sedation and painkillers in her body system than before. Also, with acute kidney failure, it takes even longer to excrete the sedatives and painkillers. Therefore, I would strongly advocate to start hemodialysis for the kidney failure rather sooner than later. So, how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll also get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype over the phone or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.